part of it. If you put a K where the C is, then you would see the beginning of our modern word knee, K-N-E-E. And this is just the Greek word for knee, which is where our modern word came from. So gastrocnemius means belly of the knee, muscle belly of the knee, so to speak. And it's almost always just called gastroc for short.
So the C is not silent.
Well, I'm curious to hear how, if you listen to the video, how he says it. I have heard people say gastrocnemius, because it's much easier to say. And since these are not in a living language, who's going to tell you what's wrong? As long as someone can tell what you're saying. I'm looking it up in the back of the book. And he does put the K in there. He says gastrocnemius. So he thinks it's not silent, for what that's worth. But we just say gastroc for short.
Yes. Is the two bellies, are they separated or are they attached?
Well, it's like the heads of the biceps. So by the time you get to the tendon, they meld, but they're separate up here at the beginning.
Are they separate in the middle of the belly part too?
Right. They're two distinct bellies, so you can see these fibers go one way and these fibers go another way.
Okay.
And Christine, thank you for asking that nice and loud, and I'll try and talk louder too.
Oh, I'm just loud in general, so.
No, but I
no problem.
What is gastro?
But so that's good on the recording. That's good for the recording.
Oh.
So.
Belly of the
knee.
So just separate like medial and lateral head.
Right, exactly. And see how, remember I pointed out the condyles are like the knuckles on the base of the femur, and here they're attaching one on each condyle.
Okay.
So that goes from the femur to the calcaneus by way of the calcaneal tendon, the Achilles tendon. Does everybody know why we call it the Achilles tendon? Because the Achilles heel, right? There was this Greek myth about Achilles who was, his mother was his mother divine? I don't remember. I think so. And she wanted him to be indestructible, and so she dipped him into a river that would make him invulnerable, nothing would hurt him, but she held him by the heel, and so the part that she held didn't go in the water, and so the legend goes he was killed by an arrow to the heel.
That's
Achilles. Your Achilles heel. Right, so that's why your Achilles heel is your downfall. Right. So for some of you today, the quiz hit you in your Achilles heel.
Yeah, isn't that, it's really hard to heal too, right?
Where we see this at? Oh.
I just know it's very painful.
So next up we have another muscle that also has the very same insertion, but it starts deeper than the gastroc. This is underneath, so you peel away the gastroc, and now you see this one called the soleus. And I believe it's named after the fish because of its shape. It's kind of a wide, flat muscle. And the really important difference between the soleus and the gastroc for our purposes doing massage is that the soleus ends before the knee. Look at that. So it does not go all the way across. It does not come from the femur. It starts on the tibia. So that means that both of those muscles have some control over the heel, over the ankle joint, because they both cross over here. They cross the talocrural joint. But only the gastroc, I have to remember how to go back here. Only the gastroc also crosses the knee. So that becomes important in the deep tissue class when we look at ways of stretching them, ways of affecting them individually or specifically. The other thing that might be worth knowing is that the soleus is a little bit wider. It sticks out on each side beyond the gastroc from underneath it. And it's so wide that it kind of comes around the front. And so it's certainly the sides. And so if you feel kind of the fleshy muscle on each side of your lower leg, which you can even access from the front at the edges, that would be the soleus that you've got.
For the knee, it's also where like sole of the shoe. So it's long, wide, flat.
I see. Yeah, you could see it that way too.
Soleus, where is that at?
So it's
Oh, okay, I see.
okay. Good. Oh Lord. Any questions about the soleus or something else? So it's I would call that posterior to the ankle joint. It's in the same position as far as the ankle joint goes, and if we back up a minute and look at the knee joint, because that's the other joint for the gastroc, we're looking at it from the back, so I would call that posterior also. Okay. Now they're showing us a cross section so you can see the gastroc and the soleus from above. And you can see how they, just between the two of them, they occupy at least half of the volume of the calf, of the lower leg. They're really the entire back half there. So very big, strong muscles. Then there's this skinny little muscle that also crosses the knee. This is the last, no, almost the last one we're looking at that crosses the knee. Called the plantaris. It goes all the way down to the same tendon. So it's going to merge with that same calcaneal tendon. It has a long, skinny tendon. The only belly it has is this little belly up here in the knee. And I have felt this in a client when it was really tight, where it was so tight that it really kind of just jumped out, and it was bothering them. It really hurt. So then it was useful to know where the other end is, because you can't feel the
Does
tendon
it hurt at the bottom, like right down here?
If you're feeling it down here, it could be a variety of muscles, because you could also be feeling, if it's the tendon that's hurting, that could also be from those two big muscles that we just looked at.
Okay.
So then you'd have to try to figure out which one is it, and one way to figure it out would be to come up here and palpate and see if this is tender.
Okay.
Otherwise, it would be the gastroc, which is this wider one right next, with the origins right next to it, or the soleus, which is deep underneath and harder to isolate. Actually, in deep tissue, if we think of it, I can show you a way to see if it's just the soleus and not the other two. Or I can actually tell you really fast, interesting. If you stretch your ankle like this with your knee flexed, and it feels like a tight stretch, then it's going to be the soleus. If you have to straighten your knee before it feels like before you feel pain, then it's going to be one of the ones that crosses the knee. So
Okay.
that's the short answer. Yes, Christine.
I have a question unrelated to plantaris.
Okay.
What's above it in the space, the hollow space?
In
That, yeah, because I looked through our book, I couldn't figure out what muscle would be there.
There isn't a muscle right here. There's another muscle nearby called the popliteus. But then the other thing that's back in this area is more like nerves and blood vessels. This is another of those so-called endangerment sites.
Okay.
Like the antecubital fossa, so when you do go palpating in there for these muscles, you want to stay kind of to the sides, because you don't want to poke right into a nerve or blood vessel right in the center. And there is an acupressure point, and right very close to the center. So just be aware. I think at the end of the chapter, there's probably a picture of all those structures, and it's probably even in the slideshow. But just in case, let's see if I can see it quickly.
Is bladder 40 just below that where his thumb is on the picture there?
I don't remember by that name, because I learned them through Jinshindo first, and so I just remember Jinshindo 31 is right around in here. And that might be bladder 40, but I don't remember. Maybe he got carried away with the details of the knee joint in other ways.
Oh, 397.
Here we go. Yes, I just saw it too. Yeah, there it is. Top of 397.
That,
That's what you're looking
that
at.
fills the gap that I had.
Yeah. Okay, thank you.
And am I correct in saying that that's above the knee?
It's kind of, yeah, it's coming from above, and you can, it keeps on going down, but it begins to be covered over by the gastroc.
Okay.
And once the gastroc and soleus are in front of it, then you can afford to dig pretty deep before you would hit it.
Okay.
Yes, Barb.
So when somebody has plantar fasciitis,
Mm-hmm.
would you work with the plantaris or would you work with the posterior tibialis?
What that actually refers to, the fasciitis means the fascia, and plantar means the sole of the foot. So the symptom shows up as initially as heel pain, and it can become foot pain and leg and difficulty walking and so on. And they're often prescribed stretches. I do stretches with them too. Some of what I do is straighten the legs, so we're stretching the gastroc and the plantaris and all the fascia, all of the above, and also the toe flexors. And there's a couple things. I do kind of a fascial stretch where I'm leaning into this foot to keep it dorsiflexed, and then I'm using my hand to create a fascial stretch going this way. I can demo this in deep tissue. And I also do kind of a pin and stretch with the flexor muscles here in the sole of the foot and with the fascia, where I'm digging my fingers into the places that feel tight, and then I'm changing the length of it. I'm flexing and extending the toes with my other hand. And that seems to break up adhesions and create more freedom. So those are some of the things that I do that help with that. So the fascial move on the calf probably addresses both of those muscles. And I also do kind of a stretch and strip there. So I basically anything I find that's tight, and it's a little different depending on what they've been favoring, if I have a tendency to walk with any kind of inversion or rotation. So it's a little different from person to person, I think.
Is that a big area? Is that condition a big part of a lot of people coming in with foot and leg issues? Is plantar fasciitis one?
Fairly common, yeah. I've seen, I would say, in the last couple of years, yeah, it can be really rather debilitating. And I've had maybe half a dozen people with it in the last couple of years. So it's good to know.
Mm.
I have a question.
Yeah.
Would that whole band be considered the muscle or just the top? Because it's the tendon.
Right. I think it depends on the context of the question. So if we're asking, which muscle is this, and we're pointing to any part of it, then you should say plantaris. But if we're asking, and it's kind of like the finger flexors and extensors. Some of them just do have long tendons, but in a sense it is still part of the muscle. Now if you're saying, is this the belly or the tendon? It's the tendon, but it's the tendon of that muscle. The tendon is really still part of the muscle. I'm not sure how much of an answer that is. Okay, here's the popliteus, the last one that crosses the knee. Same angle as the plantaris. I mean, it's also going from lateral to medial, but it's short and fat and comes to an end pretty quickly. And it crosses a little bit, well, no, they're pretty close to each other there. I think it must be deep to it, yeah. What turns out to be cool about the popliteus, I mentioned that the knee locks and unlocks, and when it's locked, we can't rotate our lower leg. This muscle, by its work of flexing the knee, helps to unlock the knee when the knee is locked. So this is if we're standing with our knees locked and we decide to soften and unlock them, we're using the popliteus. And it's named for, the popliteal fossa, which is that hollow in the back of the knee with the endangerment area. Okay, now we come to the side of the foot. These two muscles make up the lateral compartment, peroneus longus and brevis, which means the long and short peroneus. And I just looked up peroneus in the back to see what it means. And it means a shield or buckle. So I guess if you can imagine this as kind of a buckle going across. Remember, this is, if you imagine something like Roman armor, and maybe you can kind of imagine, see how they could see this as looking like a buckle, a really big buckle, sideways. Well, and if it doesn't look like one to you, then that won't be a good way to remember the name. But I'm just seeing as if the sides of the buckle are here and here, and this is more like the strap going through the buckle. That's how I'm looking at it, but I don't know if that's how they saw it. All I know is that peroneus apparently means buckle.
Is there a reason that they changed the names around from like fibularis and
I don't know. You're right. This muscle has two names, right? Because it's also called the fibularis, longus and brevis. That's equally correct. And fibularis makes more sense to me because it's named after the fibula. So it just means muscle of the fibula. It's right alongside the fibula, just like the tibialis muscles that we're going to be looking at are right alongside the tibia. So to me, that's the easier name to remember, but we do need to know both because you kind of never know who's going to use which one. Okay, so there's a long and a short one. What's kind of intriguing about them is, look at this. This one crosses over, goes under the sole of the foot, all the way across. Here it is starting on the outside by the little toe, but it goes all the way across to the first metatarsal. So that's the peroneus longus. So maybe this was the part that looked like a buckle to someone. That's a little more buckle-like to me. So if you're massaging somebody and you feel tension along the side of the outside of their calf, then it's worth checking this part of their foot too, and they'll be like, oh, how did you know that was also going to be tight?
are they more likely to have inversion then?
Let's see, peroneus does eversion actually, because it brings the soles of your foot outward when it tightens. Right, so they may have eversion, but the other, it doesn't necessarily mean that they're holding their feet like this. The other time that we do inversion and eversion with our feet is when we're walking over uneven ground, because that's what's so cool. That's why I want you to learn about this subtalar joint, because that's why if we walk on a little bit of ground that's at an angle, we don't have to go like this, or have our legs go like this and have to straighten it out here. We can straighten it out way down there. And this became very real for me recently visiting my dad, who's in California. He's 84. He's just recently let me begin to do a little bit of massage on him when he's seated through his clothes. He's very tentative about it. And he does a lot of walking on a treadmill. He stays in pretty good shape like that, but he doesn't get to the beach much. But when I'm there, we go walk on the beach. And so he'd been walking on the beach, which of course is full of these little uneven little hills, tiny hills in the sand. And so the next day, lo and behold, he was sore along there. And right. So he was adjusting his ankles to the unevenness in the sand, and those muscles weren't used to working, and they were tightened.
Did you say this movement is inversion?
Right. So inversion this is with our feet now.
Right.
So inversion is when when the soles are pointing inward. So that's like this. I should do it with my feet just. So inversion is like that, and eversion, my sole is pointing out. So think E, exit, out, and in. And then remember that it's the sole that we're describing, and it's the sole is pointing in or pointing out. Okay, so that's peroneus or fibularis, long and short, longus and brevis. And they make up the entire lateral compartment, just those two. So now we're looking at the front, anterior compartment. And this is the muscle that you could actually see through the skin, that you can often see on people from the outside. If I go back to near the beginning here, and we have those fascial views, this one right here. And one thing you can see about it, well, I'll go back to the other picture in a minute, is it crosses, it kind of goes diagonally. So the bottom of it, the insertion, is medial, but about this height, just above the ankle, it kind of crosses over this ridge in the tibia and becomes a little bit more lateral. So the meat of it, the belly, the really thick part that's easy to sink your fingers into, is more on the outside. And it's pretty easy to feel. It's the only, kind of the first or easiest thing to feel in this part of the leg, in your shin. So let's look at that. So the joint that it crosses, there's just this one. Because for now, for this worksheet, I'm not going to have you separate out the talocrural and we won't talk about the subtalar joint in the worksheet. So we'll just say the talocrural joint, the ankle joint. And so that would be primarily anterior to it, maybe a little bit medial, mainly anterior. So anterior is going to explain why it can dorsiflex the ankle. If we were looking at the subtalar joint, by that point you can see it's kind of medial to it, and that's why it also inverts the foot. But for now we'll focus on anterior. And its name exactly tells you what and where it is. It belongs to the tibia and it's in front. So that's tibialis anterior.
Why is it dorsiflexion? Isn't it dorsal back?
Okay, so let's talk about that. The words flexion and extension have carried us through most of the body. When we got to the knee, things got a little odd because we call it flexion when it goes backwards. So now what are we going to say when we get to the ankle, which goes forwards and backwards? And how are we going to not be confusing about it, especially since flexion tends to mean making the distance smaller, which looks like what we're doing when we do this. So what people have done to try to make it unambiguous is that when we get to the ankle, we don't talk about flexing or extending it. We talk about two kinds of flexion, dorsiflexion and plantar flexion. And they're named in reference to not the front and back of us as a whole, but what are thought of as the back of the foot, so the back of the hand is this bony surface rather than the palm. And so on the foot also, the back of the foot, so to speak, is this bony surface on top. So this is the dorsal surface of the foot. And so dorsiflexion is flexion in the direction of the dorsal surface. Then the sole of the foot is called the plantar surface of the foot. That's why plantar fasciitis, plantar warts are on this side. And so plantar flexion is flexing the ankle in the direction of the plantar surface of the foot. So dorsiflexion, plantar flexion. Yeah, I'm glad you asked. Yes. Okay. So there's a posterior compartment that has all these thick muscles in it. There's a lateral compartment that has just the two peroneus longus and brevis. And then there's an anterior compartment that we're beginning to look at now with the tibialis anterior.
I'm sorry, what was that one called?
Anterior compartment.
What page is this
it's
on?
written on here.
378 and 379.
Yeah.
Okay.
And okay, so here's tibialis anterior again that crosses, inserts on the medial side, kind of crosses and is very palpable toward the lateral upper shin. And so now moving over more toward the lateral side, still in the anterior compartment, here's, even though if we were moving, so here's an interesting distinction. Remember in the forearm we had muscles that just went as far as the wrist, and so those were flexor carpi, extensor carpi, and then we had muscles that went on into the fingers and thumb, and those were flexor digitorum or pollicis. So similarly here, but not quite the same language. But this one doesn't move the phalanges. It's more like the flexor carpi or the extensor carpi, the tibialis anterior here. So it doesn't go that far. And so the joint that it moves is the ankle, like moving just the wrist. And so we talk about dorsiflexion or plantar flexion. But now in this next muscle, extensor digitorum longus, this goes past the tarsals all the way to the phalanges or digits. And once we get to the phalanges, we go back to talking about flexion and extension. And extension is when they're pretty much straight like this, or even pointing upward, like the tip of an elf's shoe behind Santa's sleigh, those kind of slippers. That would be extension. And flexion for the toes is when they curl under. Like when if you try to pick up a pencil with your toes, you're flexing them. So these are extensors. This is an extensor, just like extensor digitorum in the hands, one muscle that separates into 4 tendons for the last 4 digits. And if you actually took your bare foot and tried to raise up those toes, you would see these tendons pretty clearly. And so it does extend those toes, and since it does also cross the ankle joint, it also dorsiflexes. So, okay, so what joints does it cross? It crosses the ankle, talocrural, and it's anterior to that, maybe a little bit on the lateral side. And then, I guess you could call it superior to the interphalangeal joints here. Unless, yeah, I haven't thought about this. In anatomical position, are the toes pointed or straight? I imagine that it's not pointed because it's not an exaggerated position.
And you wouldn't call it dorsal?
Oh yes, that's probably a good way to say it. So you could say it's on the dorsal side of the joint. That would be better, actually. That would be quite a bit better. I like that. Okay. So extensor digitorum longus, in relation to the interphalangeal joints, you would say it's on the dorsal side of the joints. That's good. That's very clear. Notice here, just like the flexor retinaculum that we have in the wrist that keeps all the flexors from popping out when we use them, we've got an extensor retinacula in the ankle that looks a lot like sandal straps. Plural, actually, retinacula, because there's 2 here. Sandal straps, if you had that kind of sandal. And that keeps these extensor muscles from popping out, because besides the digitorum, there's also going to be one for the big toe, extensor hallucis longus. And it comes up, I think, in the next picture. So you should know this comes that. Oh, sorry, I forgot again how to run this. I jumped farther. Okay, so extensor digitorum comes from the tibia and fibula. You're not going to need to know more detail than that. And extensor hallucis comes from the fibula. You should be able to figure out just by reasoning that if it's an extensor, it's coming from the anterior surface, it's coming from the front. Because if it were coming from the back, it couldn't do extension, it would be doing flexion of the toes. In order to do extension, it has to be anterior in front.
Laura?
Yes.
Are we on the extensor hallucis longus? Is that where we're at?
Yeah.
Were you? Oh, I was just gonna ask what hallucis meant.
It means big toe.
Oh. That was easy.
It corresponds to pollicis, which is thumb.
Couldn't think of anything that sounded like.
It looks like it should mean something more interesting and fun than that, and I don't know how it got that name.
So we actually skipped the flexors when we were in the posterior compartment then?
I think the book comes to them later. The book doesn't do the whole compartment together.
Okay.
I've noticed this before. The book sometimes starts with the big, more palpable, familiar muscles, more superficial, and then works its way into the smaller ones. So we're coming to them. We haven't seen them yet. But you're right. They belong in the posterior compartment. The flexors do. So, and notice it goes all the way to the distal phalanx, the last joint of the big toe.
And they call it a phalanx, not a phalange.
Yeah, they do.
Interesting.
Yeah. So, and that is the real singular. Now, in back of the tibia, there's another tibialis, and so since it's in back, it's called the tibialis posterior, and now we are looking at the flexors of the ankle and toes. Now we've moved around to the back of the lower leg.
I have a question on the tibialis anterior.
Yeah.
The book says that, let's see, page 379, says that the origin is on the tibia. Oh, is that the one that crosses?
Yes.
Okay, never mind. I'm sorry, I can't see it in the drawing.
Oh, yeah. It is a little hard to see in that drawing. You can see it better. Look at the drawing at the bottom right of 379.
Yeah.
That's a really nice front view of how it crosses from lateral to medial.
379.
379, lower right.
The extension
Because they're extensors, I like Barb's way of saying it. She said dorsal in terms of in relation to the toes. Both for hallucis and digitorum, I would say that they're dorsal to probably you could say to the toes for sure, and you could use that for the ankle joint. You could also say anterior to the ankle joint. So now let's go back to tibialis posterior, the one with the sort of round tendon at the top. And in the last group I had, one of the students had actually injured it and had a hard time getting the medical staff to realize all of its insertions here, all of which were hurting, and they were only really kind of treating it up here. So that class had an easy way to remember that the insertion of tibialis posterior, it actually spreads out and touches all 5 tarsal bones. It's only crossing the ankle, it's not crossing the digitorum, so we're not calling it a flexor or extensor, it's just tibialis. And what it does is not straight flexion or extension, what it does is plantar flex the ankle, which means bend the ankle in the direction of the plantar surface of the foot, which is like pointing your toes. This retinaculum here is not part of the muscle, it's a piece of fascia. It's another little sandal strap or elastic band to hold the muscle in place. And you can see it's coming around the medial side of the heel and then attaching to all the metatarsals. So it points the toes, and since it's on the medial side, it's also going to help invert the foot. So side of the joint is posterior to the ankle, and it's also pretty medial. One way to know which side of the joint to say that something's on is to look at how the pictures look. In order to see the muscle, we needed a posterior view. Right? When we were looking at the extensors, in order to see the muscle, we needed an anterior or an anterior lateral view. So that's a big clue to which side of the joint we're on. Okay. Now we're getting into the toe flexors, and it's exactly parallel to the extensors. We have a long digitorum flexor, and we have a long flexor hallucis. So flexor digitorum longus, flexor hallucis longus. You can see that feathery or pennate shape in the muscle. And since these are flexors, this is a posterior view. We're looking at the back, at the calf, and the sole of the foot. So they're crossing the ankle from behind and the digits from behind. So this would be posterior and plantar surface, plantar side of the joint. Posterior and plantar. So posterior side of the joint, looking at it from in back, that's posterior. And this is the plantar surface of the foot. This is a picture of the sole of the foot, even if it doesn't, it's hard to think of it that way. These are the flexors of the big toe and the little toes. So flexor digitorum and flexor hallucis. Yeah.
Pages 381 and 382.
Posterior and plantar, I'm saying, like this, the plantar surface of the foot. Then this is just an interesting view because you can see the muscles that go around the outside of the lateral malleolus, and I got a forgot to do this while the light was on, but I got a lower leg out here, and you can maybe pass this around and imagine if you took hold of this fibula by the upper end of it, the part that's near the knee, and if you had just the fibula, if the rest of it had fallen off, you can see how you could use this other end of it as a little hammerhead or a little mallet head, and hence its name malleolus. So if you want to pass that around, and you can just take a look at that malleolus. And then look at the inside, the medial malleolus is on the tibia. And you could do the same thing with the tibia. It would be a much heavier hammer. Yes.
So I'm looking at page 380.
Yeah.
And I'm just trying to get a reference. So it shows like the
So it's right here.
anterior, and then it's got the extensor digitorum.
All it can see
Did
it.
you say the peroneus lung?
Erroneous.
Peroneus lung. Would you compare that to the trapeziolalis for the separation between the
Yeah, you could think of it that way.
Because I was wondering if that is a flexor
Or a flexor.
but does it do both? Is it like the
I-
brachioradialis or it's kind of
I don't, in that respect, it's not, I think. I think all it does is evert. If I look at its actions on page 376, it doesn't do any, the most it does is, it helps to plantar flex the ankle a little bit. So the ankle, not the toes, but the ankle a little bit. So that would make it closer to a more like a flexor a little bit. Right, right. Yeah. You could, yeah. In some ways, I think of, I would almost see it upside down, though, of that, because in some ways I think the fibularis is a little more like the ulna, because it's kind of like the, I think of it as like the back of the arm, the back of the shin, and then the more meaty portion. The brachioradialis is kind of opposite that. It's more in the meaty section, and so that makes me think more of the medial surface. But it's not a perfect analogy.
So what would be on the other side of the foot, the
On the medial side,
to separate that?
um,
If you were gonna really try to do that kind of.
I'm not sure, I'm not sure the analogy holds perfectly, and I think one reason that it breaks, there's two reasons it breaks down maybe. One is that with the radius and the ulna, neither one of them is the big bone or the skinny bone. They kind of switch. The ulna is bigger at the elbow, but the radius is bigger at the wrist. In the lower leg, the tibia is thicker all the way down, and the fibula is thinner all the way down, and they don't spin over each other. So things don't divide up quite the same way, and then the arm doesn't have compartments, the fascia don't divide it in compartments in the way that the lower leg does.
So just have to learn it like easy on lateral. Because I always look at the side view and learn the layers. Like if you put your hand in,
Ah.
you know how in the book it'll show you
Mhm.
your hand and they have the names of it, like
Uh-huh.
finger.
Oh, I see.
So I'll just look on the inside and figure it out differently then.
I think so. Yeah, I don't think it's. I think if you try to make a perfect analogy, you might mislead yourself. Okay, so I also wanted you to see all of the arteries and nerves coming around the edge of the malleolus here. So this is the medial view, but I think there's some things going on the lateral side too. And there's also a lot of acupressure points all around the malleoli. So there's a lot of reasons for that area to be sensitive. And it's a good area to work. It can feel really good. But because of all these arteries and nerves, you don't want to like poke very hard and deep and sudden. You want to be a little bit gentle as you work there. Yes.
So I have an ankle transplant, and so
Wow.
because of some acupressure points in that area
Mm-hmm.
and having that done, does that disrupt a lot of the movement from going in the body?
I think it might. I've heard that if you have it, for example, if someone takes your gallbladder out, then your gallbladder meridian is likely to tend to be out of balance. And so it makes sense to me. This isn't quite, this wouldn't be at the organ, right, but it would be along some important meridian site. So it probably would be a little bit disruptive to the energy flow, and the person might need frequent balancing, and you might need to play around a little to find where's exactly the right spot on them. Might be a little different. Yeah. Okay. We're not going to learn these in detail, but I wanted you to take a quick look at all the muscles in the sole of the foot. So that when you massage the sole of the foot, you understand why some people really appreciate footwork. There's a lot there. You can try to follow individual toe muscles and find fibers like this. And where people need it most and appreciate it most depends a little bit on how they use their feet, whether their gait is even, whether they tend to pronate or supinate their feet a little bit. So you'll find different things on different people. But all of this is present. And there are still similarities to the hand. There are these little lumbricals, and there are the small intrinsic flexors. Intrinsic means it doesn't go beyond the foot. So these are the short flexors, right? Flexor digitorum brevis, as opposed to longus. Doesn't go up into the calf. I'm not asking you about those yet, but I just want you to see them. You can also see that, like the hand, the big toe and the little toe have some extra muscles. They don't just have flexors and extensors. They have abductors, and there's an adductor here for the big toe that goes sideways. And this is, the big toe has an ellipsoid joint, so it has a little bit of more movement than just a hinge here at the metatarsophalangeal. And so it's got some extra movement that lets the toes have a little bit left over from when the toes could do a lot more. But there's a little box in the book somewhere here where he talks about how much people can still do with their toes in cultures that don't wear shoes. And he actually mentions sewing and threading a needle, that people can actually do that with their feet. Here's another. This is a deeper layer. So after you peel off this really prominent flexor digitorum brevis, then there's the longest, the tendon from the long flexor is deep to that and comes at an angle. Here's the tendon for the long flexor of the big toe. You see the adductor a little better. And then there's yet a deeper view here where you can really see those big toe muscles in detail. So these might be places somebody could be tender or something too. Here's that extensor retinaculum in more detail, holding the extensors in place. This is kind of putting it all back together a little bit. Side view, medial view. See how the soleus almost comes around to where you can feel it from the front. Some little close-ups of the little muscles in the foot. At this point, just so you know they're there, just so you appreciate them a little. Because the knee gets injured a lot and people talk about these components, I thought I would show you pictures, your first intro to these, if you haven't experienced them personally. If you hear people talk about their ACL and PCL, that's anterior and posterior cruciate ligament. Cruciate means cross-shaped, and that refers to the X here that the two of them make together. So those help hold the femur here onto the tibia here. And by making an X like that, that would give it extra strength.
So when they tear their ACL,
Yeah.
what exactly happens?
Well, that would mean that this joint is more vulnerable now to getting dislocated, and so they probably want to be. I think it tends to happen with a sharp lateral impact. And so, for instance, if they play soccer, they shouldn't for a while it's healing. They should keep it from any sudden or excessive strain. Okay, and then sometimes you hear about people having meniscus problems or torn meniscus, and there's one, remember I mentioned the cartilage between these knobby condyles and the flat tibial plateau, and so the cartilage is these two menisci, medial and lateral. And then there's also these collateral ligaments that you can feel along the sides sometimes when they're tight. And here they're called fibular and tibial, the one by the tibia and the one by the fibula, but they're also sometimes called lateral and medial. So if someone talks about their MCL, and you think, well, I know ACL, I know PCL, but what's MCL? MCL is this one. It's the medial or tibial collateral ligament. So at least it's not so deep inside, and it's not as big. But this can be very tender if it's been hurt.
Where would the bursa be?
Let's see if there's a picture. There will be a picture in the book for sure, and I don't remember if I included it. Let's keep flipping through this for a minute and see. So this is just another view of the same things, pretty much, from the back.
Tibio-femoral. How do you say that joint?
The tibiofemoral joint, or tibiofemoral.
Okay.
Well, my question is
Yeah.
because my husband injured his knee. He did a job where he had to be on his knees for all day and
Wow.
did not use knee pads. So he's had this severe
And that was the
pain
view
in
of the knee
his knee.
joint.
We saw Justin, and Justin thought he had some fluid
Uh-huh.
and maybe bursitis.
Uh-huh.
And so he went to the doctor today, and the doctor doesn't think that there's fluid on it, but that a tendon
Mm-hmm.
is sprained or strained. I didn't quite get all the details, but I'm just trying to figure out what the injury could have been there.
Okay. Looks like I didn't save a slide of the bursa, but I think there should be a picture in the book, and if there isn't, there should be a picture in the A&P book. Here we go, page 396. So let's go ahead and turn the lights up. But I know that's frustrating when you're getting different opinions from different professionals. Yeah.
What is the joint below the ankle? What's the name of the joint below the ankle?
Okay, the ankle itself was talocrural, and the joint below it is subtalar, which literally means below the ankle.
Okay.
Mm-hmm.
Thank you.
That's a gliding joint?
Yes. Okay, so bursae, which is coral of bursa of the knee, is on the top of 396,
I don't get that
and
sheet. Oh, that's 6.
so one question is, does he have pain or swelling where any of those red parts of the picture are? He was on his knees. I could see how that could stress the infrapatellar ones, that he would be kind of on those. And actually, it talks here about the prepatellar excessive kneeling and squatting can inflame the vulnerable bursa, a condition called carpenter's knee, or housemaid's knee, depending how you got it. So that certainly seems. Yeah, well, here it says depending on your vocation. I mean, it shouldn't say housemaids, but he's making some effort here. Okay, so that's one possibility. And then if we look back at where the tendons were, certainly the tendon could be overstretched from being in that, a kind of anterior tendon could be overstretched from being in that position for so long. Looks to me like most of the tendons are inside or lateral, but I could maybe the anterior ligament.
What page are we
But
on?
he thought a tendon, right? You said rather than a ligament.
Oh, we're talking about some
Yeah.
hold on.